prosthetics. Actually, the procedure is how to convert the removable denture to the fixed prosthetics by connect with the titanium sleeve. And for the definitive dentures, is how to make the perfect impression by traditional method or digital method. In a same-day loading, the full-arch implant-supported prosthesis right after implant surgery is usually attractive treatment for the patients, but its accompanying disadvantages are complicated of placing tilt implant and positioning the multi-unit abdomen. So a basic concept of one-day surgery and loading our prosthetics are that we can use tilt implant in the posterior region. And then we use 4 to 6 implants to support the full arch fixed prosthesis. And next, immediate load when possible. And it could be a single day treatment. And Dr. Malo had published a lot of this, we call it 0-4 treatment concept and research. The treatment results show great successful outcome. So this is an immediate professionalization. First, I could done in one day, and at least we use the 4 implants are used. And the minimum insertion torque is 35 Newton centimeters. And actually, we try to convert the denture to fixed type by using the titanium sleeves. So there are many methods to do the professional prosthetics, such like traditional impression method, freehand method, or digital method, and so on. For the traditional method, here I talk about the silicone method to convert the denture to implant titanium sleeves. We can have silicone material applied to the surface of denture to find out the implant abdomen location. Then we can do the drilling make implants apertures. And next, allow the denture to attach the abdomen. It's easy to say, but in the clinical case, it's not that easy procedures because after surgery we have a lot of saliva, blood, so we don't have the good feel. So before we start, prosthodontic always start with the preoperative procedures, which including the following steps. Like first, we do the data collection, and then second, we have to compute it at design, and third, we produce the surgical scan, and last, we fabricate the interim dentures. Normally, I take 4 extraoral photos in the front view, see the facial proportion, and if it is acceptable vertical dimension. Then I will ask the patient to smile and big smile to see if the gum is visible. And lateral view for nasolabial angle and the lip support. And we also take the intraoral photos to see the teeth conditions. And we also need to collect the model and the CT informations. And after that, we'll collect all the data to the digital wakes up in the computer. And we check the implant position, diameters, and length. In this procedure, I also choose the angle of the multi-unit abdomen and design my dentures. And then next step, we produce the surgical stand. There are many kinds of stand we can design and choose. We can have the static guide, for example, like the Foley guide stand, or tooth support guide, mucosa support guide, or bone support guide. And another one is we can produce the dynamic guide, like robust assist, like S-guide, navigation guide. And next stage is produce the professional dentures. We can have it in 3D printing, acrylic milling, and traditional packing methods. So after surgery, patient come to make the dentures. We use the silicone method to locate the implant position, then drill the apertures holes, make sure the sleeve is protrude from the dentures, and then we can apply the rubber dent over the soft tissue. use acrylic to bond the denture and sleeve together. After that, we remove the denture out of the mouth. We use burr to flatten and polish the denture. The denture can screw into the multi-nut bond up to about 15 Newton centimeters. And remember to check and adjust the occlusion. So here I show one case to see how the interim denture and final denture being complete. A 50 years female with like upper full mouth periodontitis under poor prognosis. So after the discussion, she decided to do upper implant supported treatment. So we collect the data and decide the implant position and the abdominal angle in the 3Shape software. And then we check every implant size, length, and width. Make sure it's sufficient bone around all the implants. And then we send the patient to the surgery. So after the implant surgery, 4 hours later, we take the X-ray to check the implant positions. And normally, the prosthodontic see this situation in dental chair after the surgery. We see the blood, we see the sutures, heating cap, and mentally weak patients. So I changed the heating cap to the titanium sleeve and screw it up to 15 Newton centimeter as well. And then I use my prefabricated denture, try in and see if all the titanium sleeve are through apertures. It is important. If not, resin is going to stuck the screw hole and you will have the trouble to remove them out of mouth. And sometimes I use the silicone to be a base to stable my dentures. And then I use the resin pattern to connect the sleeve and pick up the denture carefully, remove them out of mouth and adjust the denture and polish the dentures. And we can deliver the dentures. So we can see the good result. So it happens in one day. And then after 6 months later, the patients come back for the final dentures. It's time to do the final dentures, and we can see the tissue heal very well, and oral hygiene is good, and all multi-unit abutments are clean. And then so we transfer the short impression coping and made the primary impressions. And we fabricate the open tray impression coping with the jig on the stone models and give it the numbers. Then we wouldn't be confused in the patient's mouth. After that, I deliver the jig individually and make sure all coping were seated well. And then I use the resin pattern to connect them together. And then we make the final impressions with the custom tray. And remember, the coping should pass through the tray, otherwise it would be difficult to remove. And then we have the final working cast. After that, we always fabricate the jig. We call it verification jig to verify the model and the intraorally if there any misfit happened. And during this procedure, I also transfer the interdenture to the working cast and mount it into the articulator, which I can get the upper and lower jaw relationship. And next we can do the tooth arrangement, the wax up. And we can have the wax up trying in the patients to see the aesthetic, to discuss with the patient about the teeth length or teeth shape, the color, if she like this. If it's okay, and then I'll send back to the technician to design our suprastructures, which is the implant metal bar. And we have to try the metal bar again to see if it is passive fit or not. And we take the panoramic film to see if any gaps between the bar and junctions. So next the implant bar with the artificial teeth try-in. And after that, we're packing and polishing the dentures. And we remember to preserve some little space beside the implants. It's easier for patient to clean. So that is the upper 016 implant supported prosthesis with implant bar over dentures type. And in the final smile, I recur, I take the good photo here. So it's how the patient teeth change. She told us now she is confident than before and love to smile now. Okay, so we go to next the prosthetics part. The prosthodontics must familiar with the prosthetic protocols, including those associated with the immediate and definite loading, prosthetic material, and occlusion assessment and technique control, like impression, intraoral scan, and concern about the peri-implant health. So we should always know biomechanics factors. It is the key for success. Like first, vertical space, or we call it interarch distance. Insufficient space is prosthetic prosthodontics nightmare. Second one is cantilever. We should minimize cantilever length when we plan the occlusal skin. And third one is occlusion. Balanced occlusion or growth function are suggested for like full arch rehabilitation, which guidance should be with flat linear pathway when moving laterally or through the protrusion. We also should be minimal the overbite. So ideally, 15 millimeter is suggested for implant bar over denture. As we can see here, the tooth length requires like 8 millimeters, and the bar requires at least like 3 millimeters. And hygienic space should maintain at least 1 millimeters for patient to clean. And cantilevers, like some textbooks suggest cantilever should not exceed twice the anterior posterior spread, and some experts decline that the only like 20 millimeter is maximum for the cantilevers. And the occlusal skin, it should be a bilateral contact point on all teeth. However, it's really difficult, but we should make sure the occlusal skin, the excursion, the protrusion should be guide smooth and no any cost interference. So we should know about like the condyle guidance, your incisal guidance, occlusal plane, cusp height, condescending curve, curve of speed, curve of Wilson. Keep them all in mind and deal with the occlusions. Okay, for the final, the definite material and design, we can classify it as two kinds. One is the bar type, and another is the bridge type. For the bar type, we have the, like, we call it IBO, it's the implant bar over dentures with packing resin artificial teeth. And another one is we call it IBZ, it's implant bar with the zirconia bridge. And oral welding is also a bar type as well. For the bridge type, such like titanium implant bridge or zirconia implant bridge, it could be one piece or two pieces manufactured. And there's one, like the new material we call Pectone. It's a Pectone implant bridge. And they all have their own advantage and disadvantages. So now we can see here is the implant bar of denture. We can design the superstructure metal bar with the resin teeth packing. This kind of product is easy to repair due to its resin material.